Some tips that I emphasize for people that I'm taking care of is really taking the medication ideally on an empty stomach, waiting 30 to 45 minutes before eating. This is often because levodopa, the active ingredient, is absorbed not in the stomach but in the small intestine. So when the medication is taken on an empty stomach, the medicine is able to have transit easily from the stomach into the small intestine. However, if there's food in the stomach when the medication is taken, the valve between the stomach and the small intestine may be closed and the medicine is trapped in the stomach. So it can't get to where it needs to, namely the small intestine, and get absorbed. So taking the medicine on an empty stomach will often allow for easier passage from the small intestine, from the stomach into the small intestine where it's more easily absorbed. Generally, this works for most people. In some people, though, the medication can cause nausea. And if nausea comes up, then often I advise people to have a few crackers first and then take the medication. Generally, I would say the crackers, have the crackers first and then wait maybe 10 to 15 minutes before taking the medication. If the nausea persists, call your doctor and discuss adding extra carbidopa, which is the blocker of nausea. And if you take extra carbidopa with each dose of the medication, the carbidopa levodopa, that can block the nausea a little bit more and reduce this pesky side effect. This extra carbidopa, though, is a separate pill. The brand name is Lidosin, and it would need to be taken with, concurrently, each dose of carbidopa levodopa. So the individual would take carbidopa levodopa with the Lidosin, and that could reduce the nausea. Another tip is to avoid taking iron or multivitamin with levodopa because that can interfere with the levodopa absorption.